evening and welcome to Beautiful Minds. I'm Prof. Angie and I've been away from Beautiful Minds for 3 Mondays. I have certainly missed our conversations. I thank clinical psychologist Seth Asafo and his collaborators in the field of addictions for keeping Beautiful Minds lively, informative, and totally pragmatic. Our topic today is living with bipolar disorder. And with me in the studio are Ms. Esinam and Ms. Cecilia. Welcome to Beautiful Minds.
Thank you.
We will also bring in Dr. Delafiagbe in a little while at 8:30, just to tell us about diagnosis and medication use in the treatment of bipolar disorder. He will not be with us in the studio. So, Esinam and Cecilia, we'll start with Esinam. Esinam, please tell us about who you are and what you do and what you would like us to know about you.
Okay, so my name is Esinam Dra. I'm a mental health advocate and a YouTuber. And I'd love everyone to know that I'm really, really happy and enjoying a very full life, even though I live with a mental health condition, which may be lifelong and chronic. Yes.
Thank you.
Thank you, too.
Thank you. Yes.
Yes, so
Cecilia.
my name is Cecilia Fofo. I also live with bipolar affective disorder, and I'm also a mental health advocate, just like Esinam, and I love what I do as a mental health advocate. What I want people to know about me is that I love blue a lot, and I love to meet people, new people, interact with them. Yeah, and it's nice to be here. Thank you.
Well, thank you both very much for agreeing to come to Beautiful Minds. Thank you.
Thank you.
Thank you. So, as I said, listeners, today our topic is bipolar disorder. Now, World Bipolar Day was observed on March 30th, which is last Thursday, to spread awareness about the condition that affects people all over the world. And bipolar is also not as well known as, say, anxiety, depression, post-traumatic stress disorder. These are more commonly spoken about. On today's show, as you have already heard Esinam and Cecilia say, they both live with bipolar, and they'll be helping us to understand what it is like to live with bipolar. So I'll just start with you, Esinam. Tell us when in your life you were first diagnosed as having bipolar disorder.
So I was first diagnosed at the age of 21. This was in 2015. Okay. So at the time, I was going to my 3rd year at the University of Ghana. So that was when I was first diagnosed with the condition. And it was very hard for me to accept because I didn't know anyone who had a mental health condition. My perception was that anyone with a mental health condition is a death sentence. It doesn't get any better. And the only people I knew who had mental health conditions were those on the streets. So I just felt like if this has happened to me, then in the long run, I would also end up on the streets and not have the kind of life that I had always dreamed about. And a series of events led to my diagnosis. So at the time at school, I was in a relationship which had to end, and it was very, very hard for me to accept that the relationship had come to an end. So I started getting depressed at school. I did not know at the time that it was depression. What I just thought was, oh, I'm sad or I'm grieving or something. So my energy was very low. I didn't want to bath. I didn't want to brush my teeth. I was finding it difficult to go for lectures. So my friend came to help me out in my room. So she helped to manage the situation from like March till June when we had to vacate. Yeah, she did
That's
very
a
well.
long suffering period.
Yes, and I know that if I had sought help around that time, things wouldn't have escalated to that level. I didn't even know that the school's counseling and placement center could deal with issues like that. So I was going through all that at school. I didn't also tell my parents, so all they thought was, oh, I'm okay. I'm okay. I just come home and then go back. I come home, I go back. So they didn't really know till I came home for vacation. And, at home, you can't hide what's going on with you. So they started seeing that something was different about me. When it's time to sleep in the night, I can't sleep. I'll talk the whole night. And what I'm talking about, too, it doesn't make a lot of sense. And my parents, too, they were dealing with their high blood pressure issues, and their high blood pressure was spiking. It just became like I was making everyone uncomfortable. And within me, I was feeling uncomfortable. So I didn't want others. So if my brother is sleeping, I didn't see why he is sleeping and I can't sleep. So, we decided my mother and I were moving from church to church to find a solution till, like, it helped, but it got to a point where we really needed professional help. And that's when my father met one psychologist in our area. She's called Dr. May Kalenu Caesar. And she helped me out and diagnosed me and referred me to Dr. Levina Jima. And they helped me to understand that, look, this condition is just like malaria. If you take your medication, you are consistent and compliant, you can still go back to doing the things you want to do. But I was very rebellious for 1 year. I was non-compliant till I realized that the symptoms became worse. At school, my behavior had changed. I was very hypersexual. I was spending my money, excessive generosity, excessive shopping. My relationships were breaking. I was just losing my priorities. Instead of school, I'll just spend time renovating my room, a hostel room, which I was spending just 2 semesters in. And I lost so much focus that I failed 3 courses at the university. But thankfully, I got a chance to do a study abroad program. So when I was leaving, I realized that, no, Esnam, for 1 year, you went without the medication. Things didn't get better. So let's try the medication this time and see. So when I did that time in 2016, taking the medication, I saw changes. Like, I was stable, I could sleep, I was more focused. And that was when I decided that, oh, they were right all along. I should just stick to the plan, go for therapy. And what they tell me is not to hurt me, it's to help me. And I was able to graduate. And then, by God's grace, my career as a mental health advocate started. Because I realized that if maybe I had known about mental health, someone had told me, I would have handled my issue more differently, because I didn't know that, oh, there's something that can affect your mental health. I didn't know about it. I just lived my life in a very different way, thinking that it was over for me. But today I'm sitting here, I'm alive and well, and I'm so happy. I am 7 years on my road to recovery, and I'm grateful. I'm grateful for all the ups, the downs, and all the tears. When I look back, I can see that, oh, I've really come far.
Wow.
Really come far. Yeah.
You have a degree under your belt?
Yes.
You did the 1 year abroad?
Yes, and I came back to resit the 3 courses I failed.
And you passed them?
Yes, I passed
awesome.
them. Yeah.
Well done.
Thank you.
So we'll come back
Okay.
and interrogate these matters further.
Okay.
So I'll just ask Cecilia. Cecilia, how about you? Tell us about your story.
Yeah, so I will say that last month marked my 5-year journey ever since I was diagnosed with bipolar. That was in 2017, March. And mine, I would say it was a childhood trauma, because initially we didn't really know what it was, but through assessment and all that, that was what I realized. My mom died when I was at age 10, around 10, 11. Yeah, I was just in primary, not even in junior high. And when she died, it was so much of a shock to me because I was very close to her. I was a mommy's girl. I was very close to her. So when she passed on, it was so new to me. I didn't know anything about death. It hit me so hard. But my family members didn't notice that I was grieving more than I should. So I would lock myself back in the room and cry all night. Then, as if that was not enough, a few years, 2 years down the lane, my sister also passed on, and that was what broke me apart more. Because this my sister I was talking to, she was 4 years older than I was, but we did practically everything together. We twined in clothes, we were in the same class, even though she was 4 years older than me. We wanted to be in the same class. If I should do something and I get punished, she will cry for me. If she should do something and get punished, I'll cry. We're twinning in clothes, and even one time we met a pregnant one. She was like, "Oh, you're twins." I prayed that I also give birth to twins. And she dashed us money. So we're like, "Oh God, we are not twins. So forgive us and bless this woman with twins." So when she passed on, I felt the world was crashing down upon me. Why have I done something wrong to deserve this? Losing my mother wasn't enough to lose my sister as well. So it was there, it was unnoticed. I grieved a lot. After they both passed on, I had to go and stay elsewhere to continue my education. So I couldn't stay with the rest of my siblings. And staying there where I went to stay wasn't easy. I went through a lot that I do not want to talk about it here. But sometimes it brings back very bad memories. Yeah, so later on there were issues and I had to come back home to continue my education. But my symptoms I started exhibiting the symptoms around late 2016 to early 2017. I got married in 2016. And just 3 months after our marriage, I started hearing voices of my mom. Very persistent, very severe. She was telling me that, "Hey, where you are, you don't belong there. You belong to me, so come to me." And the voices were very vivid. And I wonder why others around me could not hear those voices. So I would follow up the voices and move away from home, walking for a long distance, still finding where the voice was asking me to go. So that was when my husband realized that I wasn't my usual self. So he reported to my dad, and at that time my stepmom, and then they took me to a herbalist because in our Ghanaian society, when things like that happen, it's most of the time associated with spirituality, and they didn't understand. You just got married 3 months. That's not okay. So I went to a herbalist. I was there for almost 2 months long to undergo treatment. I was drinking some of the herbs, bathing, a whole lot of concoction that I had to take in. So after that 2 months, I came back home. I joined my husband. But 2 weeks afterwards, I started exhibiting more severe symptoms. Right now, it was more severe than just going out. I saw my husband to be some enemy that I need to take his life. I could take knife, I could do certain things that I really do not understand, but it was like a strong force pushing you, thinking that that is the right thing to do. I saw people around me as aliens. I could not relate to people around me. So my husband was like, "No, this is becoming very serious. Then we have to try another option because we've tried the herbalist. Let's go to the hospital and see what they can also do for us." So they took me to the hospital. That was Lekma Hospital. That was where there was a psychiatry nurse there. That's Auntie Vivienne. She upon assessing me realized that okay, then it might be psychosis because I was hearing voices and the illusions and all that. So they started giving me treatment and medication. I was put on medication. I was taking in the morning and in the evening. But I wasn't responding to the medications because I'll be stable for a while, then I relapse. I was stable for a while, and I felt that that period too, I wasn't faithful to taking the medications. I wasn't being judicious about it because at that point, I myself did not accept the fact that I was going through something like this, especially how my friends treated me. Some even said I was cursed, So I didn't want to accept the fact that then really I was cursed. I have to take medication to be well because they said maybe I've done something to God and God is punishing me for
Oh dear.
what I have done. Yeah.
Is that what Job's friends told him in the Bible? Oh dear.
Similar, right?
Yes. Oh.
Yeah. And to even worsen the situation, where I was working with, I was teaching at a private school, a school I've taught for over 5 years into my 6th year before the condition started. They became afraid of me. They thought I was endangered to the children. So they just said, we can't work with you anymore. Just go home and take care of yourself. With no compensation in our Ghanaian law as they should have. So everything became so worse for me, and I didn't want to accept it. So I wasn't taking the medication judiciously. It was mostly my husband who forced me to take the medication. So I wasn't responding properly. So they continued assessing me, and I was later on referred to Accra Psychiatric Hospital, where Dr. Henning, after assessing me, realized that, well, this might be bipolar disorder because upon frequently assessing me, he realized that there were certain times I'll be happy, even though there are times I feel devastated and I feel I do not even belong to this world. There are times too I'm very happy, things that I shouldn't be even too happy about, I'm happy about it, certain things. And he said, okay, well, this could be bipolar. So that was where I was diagnosed with bipolar affective disorder. That's in the same year, 2017. So that had been my journey. From there was an outreach, an organization, an NGO, a mental health development organization called Basic Needs Ghana. They were organizing an outreach, and then this doctor that assessed me at first, Auntie Vivian, she referred me to them, and I was invited, and I went for their program. So upon reaching there, all that I had in mind, I was new to the mental health fraternity, and I knew nothing about it. But what I had in mind there was to get someone to assist me get my job back. That's my teaching job. So I met one, Peter Yarrow, who was and is still the executive director of Basic Needs Ghana.
That's right.
Yeah, and he upon chatting with me, told me to see one colleague who was called Sunday. And then they realized that, okay, they could work with me and I could assist them because I was fluent in the Ghanaian language, that's the Ghan language, and then the tree. So then they said they invited me when they are having their programs and all that. So from there, there was an application, there was an opportunity for another member to be added to the organization. I applied for it, and I was picked, and then I started working with them. So from that journey, I would say that I started being more cautious of myself. So I decided to take my medications now more seriously because I realized that not only me going through this condition, I met a lot of people who were going through similar, and some people theirs were even worse than mine. And I was like, and these people are still grateful for life. They are still taking their medication, I was like, no, then I have to be serious because now I will have to stand for these people. But I saw these people to be vulnerable people. So I became more serious in my medication. I started reading more about bipolar disorder. I gained insights. And ever since then, my husband doesn't even say, have you taken your medication anymore? I just take it myself.
Bless him
judicious,
and bless you.
So that has been my journey for now. I'm still working with Basic Needs Ghana, and I'm still advocating for persons with mental health because I realize that they've been left out in a lot of things.
Right.
Mental health has not really been taken serious for quite some time now. Though we are making progress, but it's at a slow pace.
Yes.
So I realized that we need to do more. We need to do more when it comes to mental health. So if we need to do more, I will contribute to that. So if I will have to contribute to that, then I have to take good care of myself.
Absolutely.
To be able to contribute to that.
Absolutely.
So that has empowered me.
Right. Fantastic. So I see some similarities in both your stories. In what seems to have been at the genesis of the experience of bipolar are quite different. You know, it's like a broken relationship. Actually, our Freudian psychologists would say they're not that different after all, because for you it was a loss of a relationship that led slowly into depression and then into a manic phase or a manic episode. And for you as well, the loss of mom, the loss of sister, the loss of family, because you had to go elsewhere now for your education. So in both your cases, you experienced loss. And so that led to the sorrow of the loss, and then eventually to the experience of the mania. So, but it's interesting that in bipolar, even though the definition of bipolar means that you have had to have had one very manic episode, most of the experience of bipolar disorder is with depression.
Yeah, that's true.
Yes. But the other thing that is common to both of you is that it took a while for you to accept the diagnosis and to take the medication that you required. You were required to take, so you would get on an even field.
Yeah, and even when you are taking the medication, people will come up at you and say, you are a Christian. Why are you taking this medication if you believe in God? Like, why are you doing that? God heals. Like, if you are taking it, it means you don't believe that He's healing you. So sometimes you yourself, it gets to a point you'll be questioning that, if I take this medication, that means I don't believe God has healed me. I actually went to a church one time and the pastor prayed for me and said I'm healed. So I asked him that, so should I stop taking my medication? He said, I should stop. And I told him, look, I know what happens when you don't take your medication. You relapse. He said, we are at a camp, an atmosphere like this, you can never relapse. And I really relapsed. I just spent all the money in my bank account. And that's when I had to realize that, look, taking a medication doesn't mean I don't believe in God, because God can use people to help you. Even in the Bible, He always used people. He can use medication. He can use mental health professionals. So it doesn't mean that I don't believe in God or I don't have faith. Yes. So it's some people feel like the day that they decide to finally walk into the hospital and seek professional help, it means they are walking back on God, and it doesn't help. Even in the churches, some pastors will not want to admit that maybe the person they are counseling, it's not really a spiritual thing. It's their mental health which is at stake.
Right. Yeah. So hold the thought. I want to come back to that, but we have Dr. Fiagbe on the line with us. Hi, Doc. Hello, Doc.
Hello, Prof. Good evening.
Hi, good evening. Well, thank you so much and welcome back to Beautiful Minds.
Thank you.
Yeah, we have not had you here for a long time. Listeners, Dr. Fiagbe is a neuropsychiatrist and a consultant. So, Doc, you meet our two guests, Cecilia and Esinam, and they both lived with a diagnosis of bipolar for at least 5 years.
5 to 7.
5 to 7 years. And they have a most amazing understanding of their condition. But we'd like to know from you how you would diagnose bipolar disorder.
Okay. Good evening once again, and then to your listeners.
Good evening.
I hope I can be heard clearly.
Yes, we hear you, but you can speak a bit louder.
Okay. All right.
Great.
Yeah. So I think your analysts have done a good job. They've been able to articulate their symptoms clearly, and from our standpoint as professionals, we'll take a very lengthy history, and the objective of that is to bring out some of the symptoms that you mentioned. We know that bipolar are cycles. You can have a cycle where you feel low, the other end you may feel quite excited. So our history taking should be able to bring out all those symptoms when you're feeling down and out, feeling hopeless, feeling like the world is crashing on you. With lots of pleasure and activities that you're interested in a few days or a few months back. And then we switch to the other side where you are excited, irritable, you get quickly, you have the lose provocation, you are crying. Also very hypersexual, not the analyst mentioned. So if you are able to exhibit demonic symptoms up to about a week, you make a diagnosis of bipolar. But the history should be able to bring out the depressed episodes. I think spot on when you said most episodes begin with the depressive component. So by and large, that's where possible, we run labs and see if there are any comorbidities that could also lead to these symptoms. So basically, that's how we arrive at.
Okay. And how would you treat bipolar disorder?
Okay, I think the treatment basically depends on the presentation by the patient. If the patient comes to the management, we have regimen for acute manic episode that we will activate. That includes a little bit of sedation and then tranquilization to of the individual.
You want to calm them if they're agitated.
We have achieved. Can you hear me?
I was just saying, so you start out by bringing some calm first.
Precisely.
Okay.
Yeah, so when that is done, we move into a maintenance phase where we decide on whether we'll give you an antipsychotic or we'll give you a new stabilizer based on the presentation that the individual comes with.
Okay.
So if the patient presents more with psychotic symptoms, then obviously we might lean towards the antipsychotic. Presents more with the mood symptoms, then we might align towards the mood. Gold standard for most of the lithium, quite magical.
Say that again, please. We didn't quite hear you.
Oh, I said the gold standard for managing the mood component of bipolar is lithium.
Okay.
And I said it's able to turn people around about a week.
Oh, wow.
So if they manage to take that medication in a week, their mood usually should get stabilized. And then we can continue that between 6 months to 1 year. And that's where the challenge is. When people feel well, and it becomes a chore taking medication every day. So the paradox of the protocols for individuals who come manic phase. They also come in the depressed phase. They have antidepressants, they are available that we administer to them.
Okay.
that's able to help them out.
Okay.
So we are quite cautious with the question of antidepressants, ask doctors to send them into the manic phase. So there are special medications that is able to adjust mood as well as in the manic phase as well as the depressive phase. So a little bit of calculation and permutations and combinations for each patient.
So there is a science to this, is what I'm hearing from you and what I heard from Isinam and Cecilia. There is a science to this. There is knowledge in the treatment of bipolar. So thank you very much for this. But what would your advice to Isinam and Cecilia be?
Well, I think they are doing a job. I mean, being advocates and having reached a decision to be consistent on medication. It's like the summit of every mission or treatment. That's what we aim at. Our patients to get to the point where they have decided to consistently take medication. I think they should just go on that path and continue to advocate, preach this news to people out there who might need the kind of help they also have.
Great.
Thank you. It's true.
Yeah. And then your advice to families of people with bipolar.
Yeah, I think that in one of the panelists' submissions, they made it clear that the subject for bipolar condition is the brain. So there is something absolutely wrong with the individual mental health, for which medication can help. I've had quite a number of people who have benefited from medical treatment, who roaming from church to church, from shrine to shrine, trying to look for a shortcut, and eventually that affects their occupational lifestyle and their ability to interact well with society. So they should all know that there's options. There's no point for me to do all that ordeal only to get them worse when there was a better option available. So they should keep the belief, but they should know that there's a medical treatment for that condition as well.
Right. Wow. Well, thank you so much, Dr. Fiagbe. We've heard you tell us that this is bipolar disorder is a condition that is treatable, and really and truly people should keep their faith, their spiritual faith and belief, but come and get treated, and that it's really possible to lead as normal a life as possible on medication. There's no need to beat about the bush, as it were. So we promised we wouldn't keep you more than 10 minutes, and we just thank you so much for joining us, Doc.
Thank you, and have a lovely discussion.
Thank you. Good night.